Welcome back to the Build Beyond podcast. This episode, we are talking about tendonitis. This is going to be perfect for you if you have ever been told that you have tendonitis. This is, I think, one of those diagnoses that is pretty common and ends up being this chronic issue where people feel like they have this tendon problem for years. And most of the time it prevents people from doing the things that they want to be able to do. And it can be very frustrating because it's hard to find answers. So today I want to walk you through the basics of tendons. And if you actually have a tendon problem, how we would work through that. I want to be upfront though, this podcast episode is not designed for diagnostics. So please don't take anything from this podcast and use it as, medical advice or healthcare advice. Ideally, this podcast is just giving you information. So if you don't know and you think you might have a tendon problem or you're not 100% sure of the diagnosis, I highly recommend that you go find someone who's qualified to make that diagnosis. So this podcast I will be talking to you as if we already know and are confident that the diagnosis is accurate, that you actually do have a tendon problem. Now, keep in mind, you may have a tendon problem, but you may have other issues going on as well. That's not uncommon. You are allowed to have more than one thing going on. So could you have a tendon problem and also have some arthritic changes and also have some type of nerve issue or a torn muscle or anything else going on? Yeah, that could happen. It's really common. And if you have multiple issues stacked on top of each other, it may or may not change the treatment recommendations. And that's why I'm saying that even if you're confident that you have a tendon problem, are you confident that there aren't any other things going on? Because if someone has a tendon issue, and it kind of depends where it is, and they have other things going on, I might change my recommendations. The recommendations that I'm about to go over might not be the same. So don't take this as medical advice. Just use this as information. And then if you're going to go talk to someone about your diagnosis, then you would have more information about the next steps, as long as that healthcare provider was confident that it is a tendon issue. Okay, so let's go over tendons. I'm going to use a very good reference. I'll list the reference in the show notes. If you're not a healthcare provider or a strength and conditioning coach, I don't recommend getting this book. It's not an easy read. So I'm not going to read straight from it. I'm just going to use it as a reference to walk you through this. So tendon problems, typically tendon problems are overuse issues. I don't think that's news to anyone, but if you have a tendon problem, it typically gets called tendonitis, and itis means swelling. And I think that is an oversimplification of tendon problems, because when you have a tendon injury or tendon pain, there is oftentimes there's going to be swelling. But if swelling was the main problem, that's pretty easy to deal with. So if it is just a simple tendon swelling issue, we should be able to ice, rest, compression, treat it like something very common, and then you should be able to move on. And that's typically not what happens. So we've got a tendon overuse problem. The clinical presentation for this is usually straightforward. So in many cases, the patient presents with tendon pain during or after activity. So you go and you load the tendon, you put some stress into it, you go, ow, that hurts, that pain increases, and then within 10 to 15 minutes, that pain kind of goes back down to baseline. It is unlikely that inflammation, aka swelling, is a key driver in tendon pathology. Again, swelling may or may not be present at different stages of a tendon issue, but it's not at this point believed to be a key driver. So why does this matter? Because if you've been diagnosed with tendonitis and you're given a protocol of rehab or care, that is heavily dependent on treating a swollen tendon, you're going to be going down the wrong path. You're treating something that exists because the swelling probably is there, but the swelling is not more than likely the key issue or the root cause, if you would like to use that term. So here is a more detailed clinical presentation for someone who has an overuse injury to a tendon. They'll have pain after exercise, or more frequently, the following morning when they get up. It can be pain-free at rest initially, and then it becomes more painful with use. So you use it, ow, rest, feels better. Use it, ow, rest, feels better. You have that pattern. Athletes can run through the pain or play through the pain, or the pain disappears when they warm up, only to return after exercise when they cool down. Athletes are able to continue to train fully in early stages of the continuum, and this may interfere with the healing process. A physical exam reveals local tenderness and or thickening. I think it's hard to tell clinically if there's thickening, but there's local tenderness. So usually someone can point right to it. It's not like, oh, this big area hurts. It's like, no, I put pressure on it, or I contract, or I use it, and it hurts right there. And then I can touch it sometimes, and I'll be like, ow, yeah, that bothers it. You might see swelling or crepitus. Crepitus is like, it's hard to move the joint. It might be a little like snap, crackle, pop when you move through it. Although, if there is crepitus, that's usually a sign that there's also something else going on. We have 3 stages of tendon pathology. This isn't necessarily that important for you as the individual to understand these stages, but I think it's important to understand that there are stages, because most of my patients are going to fall in one stage, and I'll go over that right now. So stage 1 is a reactive tendinopathy. This is the non-inflammatory response. This is typically seen in younger athletes. So if you're not a youth athlete, you're probably not having a reactive tendon. Maybe you did at one point and it kind of moved along the continuum. So this results in short-term thickening of a portion of tendon to reduce the stress. So there's overuse, and it's the brunt of that is taken on one part of the tendon. It gets thicker, so that it starts to distribute the stress to other parts of the tendon. This can also happen if there's trauma, so like a direct blow to the tendon. Stage 2 is tendon disrepair. This is worsening of the pathology that we just talked about. It's seen clinically in overloaded tendons in young athletes. So again, if you're older, probably not happening to you, but it can appear across a spectrum. I guess it just depends. So it's a transition from the previous stage, and it's difficult to tell the difference between stage 1 and stage 2. So I don't even really ever try. I just assume that they're both kind of going on to a certain extent. Because another thing to think about is that if you've got a tendon, which connects muscle to the bones, that middle piece, if you have a tendon problem, it's usually not the whole tendon. There's going to be pieces of the tendon where it's getting the most stress, and that's where these issues are happening. Stage 3, degenerative tendinopathy. This is what I see in most of my patients if they're not youth athletes. So this is the end stage of tendon overuse. This exists in the older person or the younger or elite athlete with a long-term tendon issue. Typically, it's seen in middle-aged recreational athletes with focal tendon swelling and pain. Like I said before, you can point right to where it hurts. A degenerative tendinopathy exists in a tendon that has normal tissue. When these tendons are overloaded, the degenerative part, so again, it's not the whole tendon, you've got pieces in there that are affected. The degenerative part of the tendon is unlikely to take that load because of the cellular changes that have happened. So the load is distributed to the more normal parts of the tendon. So you can see this is actually a pretty neat engineering piece. So you've got one portion of the tendon that's getting a lot of overload. It gets thicker, it undergoes changes so that when load starts to come into there, instead of overloading that spot, then the body kind of naturally spreads that load out to other parts of the tendon. Overload can induce reactive changes in the normal part of the tendon, resulting in a reactive or a degenerative tendon. So you can kind of see this continuum. So maybe you're a youth athlete and you play a sport. Maybe you're like a baseball pitcher, and you start to develop some kind of elbow tendon issues. So you're overloading that tendon. You may start in stage 1, where you have this reactive tendinopathy. Over time, it progresses to stage 2. Now maybe you're older. Maybe you're a recreational athlete. You're going out, you're trying to play rec league, softball. That tendon issue comes back up. Well, it's probably at this point gone to this degenerative stage. So you've got these portions that were affected when you're younger. They've gotten thicker. They're less stretchy. The cells have changed. You still have healthy tissue around it throughout the tendon, and you're going to use it again. So what the body's doing is distributing that load to other healthier parts of the tendon. And then what happens to them? They start going through these stages again. So you might have a part of the tendon that's never been overloaded before, but now is being overloaded, right? So you go through it may go through stage 1, stage 2, and you can see this can spread throughout the tendon. So what do we do if let's say we have an accurate diagnosis and we're going to treat it? The first thing we do is we make sure we have an accurate diagnosis. Again, that if you get the diagnosis wrong, inevitably you're going to apply the wrong treatment, probably, I guess, unless you accidentally get it right. And that's going to lead you down the wrong path. So step 1, make sure you have the correct diagnosis. Okay, so now we're confident, hey, this is a tendon problem based on the age and the demographic and the use. We're thinking it's degenerative, which again, it doesn't mean that the tendon's wasting away. It's actually, there's just cellular changes. I don't know why they picked the name degenerative, but it's probably not a good representation, because I feel like when people hear that, they think that their tendon's wasting away. It's actually getting thicker in this case. So what would we do? Well, we're going to start with isometric exercises. Isometric is contracting with no movement. So think about the difference between a plank and a sit-up. So you can picture a sit-up, you're moving so that the abdominal muscles are getting short and getting long as you move through it. But we could also do a plank where you just hold. So you're using those same muscles, but not to move, to create stability. That's isometric. So with whatever body part we're talking about, we're going to use some isometric exercises. They're a great way to relieve tendon pain. So isometric exercises result in pain relief within 7 to 10 days in a reactive or a degenerative tendon, but can take up to 6 to 8 weeks if you have a purely reactive tendon. The next stage, we'll do isotonic exercise. So we start to add in some movement. So let's say it was an elbow pain. We might do isometric where I'm pushing against something, but my elbow is not actually changing length, like it's not moving. And now we're going to maybe switch to like a bicep curl. When we do this movement, we're going to focus more on the eccentric, so the lengthening of the muscle. And these are going to be slow, relatively controlled movements, relatively heavy for the person. Stage 3, we're going to talk about energy storage. So this is where we're going to start to move faster. So we started with isometric, which is no movement. It's just a strong contraction. And then we moved to isotonic. So we added some movement, but it was slow and relatively heavy. Now we go to energy storage. So now we're trying to move quick. So we're thinking about that concentric. So instead of the slow lengthening, we're thinking about fast shortening. And then stage 4 is more sports specific energy storage. So in stage 3, we may be doing, let's say, some dumbbell exercises that target the tissue, but they don't really mimic sport. But now we're going to take that athlete probably into their sporting environment. So let's say it's a soccer player and we've had her in the gym doing machines or dumbbell work or bands or things like that. Well, now we might actually take her to some turf, put her in her soccer shoes and have her start to do some more explosive work. Now, obviously, this is going to be a little bit different depending on the tendon issue. For example, patellar tendons in the knee, they tend to be a little bit different. The rehab can be a little bit different. Although I think it's very similar. There's nuance to it. There's nuance to the person. There's nuance because of the sport, the amount of time that you've had, what kind of stage you think the tendon issue is in. If you have anything else going on, so are there multiple diagnoses? We have to think about that, and whether or not this is actually a tendon issue. But I will say, regardless of what's going on, if you've been told that you have tendonitis and you've been prescribed anti-inflammatories, rest, ice, compression, elevation, that's not going to help. It's just not. It's going to feel better for sure because you're not putting stress through the tendon. But ultimately, if your goal is to get back to physical activity, that protocol is just not going to get you there. All of those things could be used. I don't have a problem with ice and rest and compression and elevation because there might be some swelling going on top of the larger tendon issue. And all of those things can be great for short-term pain management. But if that's your plan and then you're frustrated because it's been years and you haven't been able to get back to doing what you're doing or what you want to be able to do, then that's probably why, because it's an incomplete program. It's focusing on the tendon swelling, which, although it might be present, is not the key driver of your disability. It's not the reason why you can't get back to doing what you're doing. It's not as simple as getting rid of the swelling and then everything's good. There are actual changes that are occurring to the tendon that we can't undo. And we call them pathology. We say degenerative tendon. All these things are really scary. Again, I don't think they're named well. I wish we had different names for them because they sound ominous, but most of this stuff is just normal changes. The body was designed to do this. We just have to do the best that we can to diagnose and understand, and then create a rehab and a treatment program that respects the natural process, but also moves you towards the activity that you want to be able to do. So, in summary, if you think you have a tendon problem, step one, don't use this podcast as a diagnostic tool. Go get evaluated, and get evaluated by someone who knows something about tendon issues, specifically someone maybe with a sports medicine background. And that can be hard to determine. I would look for someone with some type of board certification. So I'm a chiropractor. In the chiropractic world, we don't regulate the term sports chiropractor that well. Most people who call themselves sports chiropractors are just general chiropractors who like treating athletes. They may or may not be good at diagnosing tendon problems. In my experience, most of them aren't. Within the chiropractic world, you're going to be looking for someone with letters after their name, CCSP, Certified Chiropractic Sports Physician, which is kind of the base board certification that you can have as a sports chiropractor, or you could look for DA-CBSP. That's a diplomate of the American Chiropractic Board of Sports Physicians. So that's the higher level. That's like, as a chiropractor, if you wanted to go treat athletes at the Olympic Games, that's the level that you would go to. In other professions, I don't know the letters behind everything, but I would, if you're curious about someone, ask about board certification, especially with physicians. All physicians will probably work with an athlete, but if they haven't gone through that extra training, they're just going to treat it like tendonitis, I don't think you're going to get the results that you want. So step one, go get a decent diagnosis. Make sure you have some confidence that it is a tendon problem, and that you have some confidence that there might not be anything else going on in the joint, and if there is, that it's not going to conflict with the treatment plan. Step two, find someone who's good at rehabbing tendon issues. So if your tendon problem is being treated not with these stages, isometric, isotonic, so that's slow, heavy, and then moving on to the energy storage, moving quickly, and then something more sport specific or activity specific, it's not necessarily bad, but I would question it. Like where are they getting that information? Why are they using a different protocol? Again, it's not necessarily a bad thing, but if you've had this problem for a while and you haven't got the results that you want, we can't keep doing the same thing and hope for a different result. So if you're still listening to this, you're probably looking for a different result. If you don't know where to turn, shoot me a message. If you're in Michigan, I can help you. I practice in Michigan. If you're not in Michigan, I don't know, send me a message and let me know where you are. I might know someone in your area, or at least in your state, that you could contact. All right, I hope this has been helpful. Thank you for listening.